Hello everyone, welcome to the Drug of the Day series. Today we will learn about the drug ibuprofen. So let's start. Ibuprofen belongs to the class of non-steroidal anti-inflammatory drugs, antipyretic as well as analgesics, and they are divided into four subclasses, that is non-selective COX inhibitors, preferential COX-2 inhibitors, selective COX-2 inhibitors, and analgesic antipyretics with poor anti-inflammatory action. And our today's drug of the day, that is ibuprofen, belongs to the class of non-selective COX inhibitors, and under that it is coming under propionic acid derivatives. Then other drugs which are belonging to this particular class are naproxen, ketoprofen, flurbiprofen, and there is another drug called phenoprofen. Okay. Then we can notice one thing in this particular class, that most of the drugs belonging to this class have pro in their infix. Okay. So what does this mean? This indicates that they are belonging to the propionic acid derivatives. Then this non-steroidal anti-inflammatory drugs which are there, okay, they are having anti-inflammatory, antipyretic as well as analgesic action, okay, in different measures. So what does this mean? So for example, aspirin, at low dose aspirin is having antiplatelet action. Then at medium dose it is having antipyretic and analgesic action, and at high dose it is having anti-inflammatory action. Okay. Then paracetamol is having most of the action as antipyretic, okay, and very poor anti-inflammatory action. So what does this mean? Okay, this means that these actions, okay, this different action varies, okay, depending upon the drugs and depending upon their doses. Then this COX enzyme which is there, okay, cyclooxygenase enzyme, is involved in the synthesis of prostaglandin, and this NSAIDs act by inhibiting this COX enzyme. So further synthesis of prostaglandin won't occur over here. Okay. Then propionic acid derivatives. Members of this class represent most widely used NSAIDs. Okay, and they are most of the members are also available as OTC, that is over the counter products. Okay, example ibuprofen, naproxen, ketoprofen. Then although this class of drugs, okay, most of the drugs are available as OTC, we should not make indiscriminate use of this kind of products. Why? Because it has resulted in an increased incidence of complications in adolescents, including acute and chronic renal failure. Then they have similar pharmacodynamic property, that means almost all of them have same mechanism of action, but differ in their potency and to some extent in their duration of action. Ibuprofen has been rated as the safest traditional NSAID by the Spontaneous Adverse Drug Reaction Reporting System in UK. Now we'll see the mechanism of action. Okay, so what happens first? The chemical and mechanical stimuli, okay, activates this particular phospholipase A, and this phospholipase A will convert membrane phospholipid to arachidonic acid. Okay, then this several enzymes such as cyclooxygenase, lipooxygenase, then further convert this arachidonic acid to the other products, like cyclooxygenase will convert this arachidonic acid into different prostaglandins. Then lipooxygenase will convert into leukotrienes. Okay, but our major focus today is on cyclooxygenase. Okay, that NSAIDs will block this particular enzyme, and we have already seen that our drug of the day, that is ibuprofen, is non-selective COX inhibitors. Okay, it can act on any of the COX enzyme. Okay, then ibuprofen, we'll see the structure. Actually, their structures and their names are very easy to remember. Okay, so first one, ibuprofen. Ibu, that means isobutyl group is there over here. Okay, pro means this propanoic acid, and this phen means this phenyl group. Okay, the next drug is naproxen. So Na stands for this naphthalene ring. Then pro is for this particular propanoic acid, and this methoxy group which is there. Okay, ox means methoxy group. Then flurbiprofen. So flu means this particular fluorine group will be there. Then bi means this biphenyl ring system. Pro means this particular propanoic acid and phenyl group. Okay. The next drug is ketoprofen. So you can see keto group over here, propanoic acid over here, and phenyl groups over here. Okay. Then phenoprofen. Pheno means we can see here phenoxy group, right? So this particular pheno stands for this phenoxy. Okay. Then pro for this propanoic acid and phen for this phenyl group. Okay. And one more thing you have to notice that this particular carbon which is there, okay, in this particular drugs is chiral carbon. Okay, this particular carbon is chiral carbon. Okay, and this methyl group over here is attached with the alpha configuration. What is chiral carbon? Chiral carbon means all the four substituents are different. Okay. So the introduction of the alpha methyl group in the carboxylic acid side chain results in the chiral carbon. Okay, अभी हमने देखा था last slide में वो. And thus the existence of the enantiomers, except the drug oxaprozine. Okay, remember this. Then even though most are marketed as racemates, only S enantiomer was found to have any inhibitory activity against COX isoenzymes. Hence, this enantiomers is responsible for the therapeutic action as well as the drug-induced GI side effects and nephrotoxicity. Most of the drugs of this class are marketed as racemates. Why? Because of the rapid epimerization of R enantiomer, which is inactive, to the S enantiomer, which is active, okay, which is having the therapeutic action. The inactive R enantiomer, okay, R levo enantiomer is inverted to S dextro enantiomer in vivo via the 2-aryl propionyl coenzyme A epimerase. Okay, this is the enzyme. Okay, remember this. Then we'll see the structure activity relationship of ibuprofen. Okay, this is a structure of ibuprofen. This is a isobutyl group, phenyl group, and propanoic acid group. Now we'll see the IUPAC nomenclature. So the parent chain which is there is propanoic acid. Okay, this particular thing. Then numbering starts from here, 1, okay, 2, and this carbon will be 3. Okay, now at 2 position, we are having this particular substitution. Okay, now second is phenyl. Okay, this phenyl group, and at 4th position of phenyl, okay, 1, then 2, then 3, and 4th. Okay, this 4th position of phenyl which is there, okay, we are having 2-methyl propyl substituent, this particular one. Okay, 2-methyl, okay, this 2-methyl 1, 2, 3 propyl substituent. Okay, then we'll see, we have already seen this particular thing, right? There's like this particular substituent is isobutyl group, then this particular one is phenyl group, and this particular one is propanoic acid group. Okay, now this CH3 group which is there. Okay, so we'll see the substitution of this alpha CH3 or methyl group on the alkanoic acid portion of the acetic acid derivatives enhances the anti-inflammatory action and reduces many side effects. Okay, what it does, it enhances the anti-inflammatory, that is the therapeutic action, and it reduces many side effects. Now we'll see one example. The acetic acid analog of ibuprofen, that is ibufenec. Okay, remember this, that is para-isobutyl phenyl acetic acid. Okay, is less potent. Okay, is less potent and more hepatotoxic than ibuprofen. Why? Because this particular ibufenec is not having this alpha CH3 substitution. Okay, and hence it is having more of the hepatotoxicity and less, it is less potent. Okay, but whenever there is alpha substitution, we will have enhanced anti-inflammatory, that is the therapeutic action, and it will have a reduced side effects. Okay, then the dextro enantiomer of ibuprofen possesses the greater activity in vitro than the levoisomer. The dextro enantiomer of ibuprofen has been shown to possess S absolute configuration, that is S dextro isomer, okay, which is active one. Then the stereochemistry associated with chiral center in the aryl propionic acid derivatives has an important role in both in vivo as well as in vitro activities of these drugs. Okay. Then we'll see the synthesis. So in synthesis, route 1 from isobutyl benzene. Okay. So this is a structure of isobutyl benzene. Okay. We know the structure of ibuprofen, right? So what is required in this particular structure? We are not having that particular propanoic acid of ibuprofen in this particular structure, right? So we have to add that. So we'll now see the synthesis part. So first we are adding HCl, HCHO, okay, in the presence of ZnCl2. Okay, we are getting here chloromethyl group. Okay, then we are adding NaCN, okay, sodium cyanide. Then we are getting methyl cyanide group. Okay, so we have already got the 2 carbons, okay, of the propanoic acid, one this carbon and another carbon of this cyanide group. Okay, then we are adding the soda amide, that is NaNH2. Then sodium group is added over here. Then CH3I. Okay, then CH3 is added over here in place of sodium. So now we have all 3 carbons. Okay, the one carbon is this, second carbon is this one, and third carbon is this CH3 carbon. Okay, and then after acidification, we are getting the structure of ibuprofen. Okay, then another way is route 2, that is also from isobutyl benzene. Okay, here we are acetylating it. Okay, then we are getting para isobutyl acetophenone. Then after adding the hydrogen cyanide, we are getting the cyanohydrin derivative. Okay, and then after HI reduction and hydrolysis, we will get the ibuprofen drug. Okay, then metabolism. So metabolism is majorly by CYP2C9, okay, and CYP2C19. Okay, CYP2C9 around 90% of the action or the metabolism is done by CYP2C9, and around 10%, okay, around 10% of the action is done by CYP2C19. Okay, it involves primarily the omega 1, omega 2 oxidation of the para isobutyl side chain. Okay, this particular side chain, para isobutyl side chain. So first, this particular alcohol, which is their OH group, okay, it is attached to the tertiary carbon, okay, because this particular carbon is attached to 3 different carbons. Then over here, this alcohol group is attached to the secondary carbon, because this particular carbon is attached to 2 carbons, and this particular OH is attached to the primary carbon, okay, because this particular carbon is attached to only 1 carbon. Okay, so in this way the oxidation take place. Then the alcohol oxidation of the primary alcohol, okay, primary alcohol means this one, okay, resulting from the omega oxidation to the corresponding carboxylic acid. Okay, then further this particular isomer will be converted to the carboxylic acid, with corresponding carboxylic acid, and all of the metabolites are inactive. Metabolism occurs rapidly and the drug is nearly completely excreted in the urine as unchanged drug and oxidative metabolites within 24 hours after administration. Okay, and some metabolites can also be glucuronide conjugates. Okay, then absorption. Ibuprofen is rapidly absorbed on oral administration. Its plasma T-half is around 2 to 4 hours and the duration of action is less than 6 hours. Then protein binding. Ibuprofen is acidic drug and it is extensively bound to plasma proteins around 99% and will interact with other acidic drugs that are protein bound. Okay, but this particular interaction is not clinically significant. Then concurrent treatment with ibuprofen has been found to prevent irreversible COX inhibition by low dose aspirin. Okay, we know that aspirin irreversibly binds to COX. Okay, and ibuprofen reversibly binds to COX. Okay, so concurrent treatment with ibuprofen has been found to prevent this particular irreversible COX inhibition by low dose aspirin. Thus, the antiplatelet action of ibuprofen is short lasting, okay, and it abolishes the antiplatelet action and cardioprotective action of low dose aspirin. Then uses, ibuprofen is used as a simple analgesic, as an antipyretic. Then it is used in dysmenorrhea, okay, in which the prostaglandin synthesis is increased. Okay, in dysmenorrhea means menstrual cramps. Okay, in this dysmenorrhea, the prostaglandin levels increases. Okay, and that increase in prostaglandin leads to the increase in contractions. Okay, so to inhibit this prostaglandin synthesis, we are giving ibuprofen. Then it is also used in rheumatoid arthritis, osteoarthritis, mucoskeletal disorders. Then it is used to reduce fever, and it is also used in relieving the dental surgery pain. Adverse effect, they are better tolerated than aspirin. Okay, their side effects are milder and also incidence are lower. Some of the adverse effects or side effects are gastric discomfort, nausea, vomiting, okay, though less than aspirin and indomethacin, but these particular side effects are most common. CNS side effects including headache, dizziness, and blurring of vision and tinnitus. Tinnitus means ringing in ears. Rashes, itching, and other hypersensitivity phenomena are very infrequent. Interactions, they inhibit platelet function, so use with anticoagulant should be avoided, okay, because the chances of bleeding increases. Then they decrease the diuretic and antihypertensive action of thiazides, furosemide, and beta blockers. Then contraindications, they precipitate the aspirin induced asthma, okay, and also they are not to be prescribed to pregnant women and should be avoided in the patients of peptic ulcer. Okay, why? Because the prostaglandins which are there, they are having the mucoprotective, or they decrease the acid secretion and they increase the mucus production. Okay, so they actually help in peptic ulcer, but by inhibiting the prostaglandins, we will what will be the case? This particular peptic ulcer will exaggerate. Okay, that's why it is contraindicated or it should be avoided in peptic ulcer patients. Then some preparations, Brufen, okay, by Abbott. Then ibuprofen paracetamol suspension, that is ibugesic plus, okay, it is majorly for the pediatric class of patient, okay, strawberry flavor. And ibucin by that is 200 mg, 400 mg, 600 mg by AstraZeneca. Okay, this ibugesic is by Cipla. Then we'll solve few MCQs, but before that, if you want more such videos, please subscribe to our channel, Dharmesh Mehta GPAT. Press the bell icon and you will be notified every time a video is posted. We also have a free WhatsApp group where we post daily 5 MCQs. So if you want to get added on that group or if you want to join the classes, you can just contact on these numbers. You can mention your name, your college name, and we'll do the needful. Then we'll come to the MCQ part. So first question, which of the following drugs inhibit platelet cyclooxygenase reversibly? Options are alprostadil, aspirin, ibuprofen, and prednisolone. Okay. So first one is alprostadil. Alprostadil itself is a prostaglandin. Okay. It is a PGE1 prostaglandin. Then aspirin. Aspirin inhibits COX irreversibly. Okay. Ibuprofen is a reversible inhibitor and prednisolone blocks the phospholipase A. Okay. The first enzyme. So the correct answer over here will be ibuprofen. Okay. It reversibly inhibits this platelet cyclooxygenase. Then next question. Which of the following is active isomer of ibuprofen? Okay. This also we have already seen. Okay. That S configuration and the dextro isomer is active. Okay. Then the next question. NSAID with poor anti-inflammatory action is paracetamol, ibuprofen, diclofenac sodium, and celecoxib. So in the main classification, we have already seen that paracetamol comes under the class of poor anti-inflammatory action, right? So the correct option over here will be paracetamol. Then ibuprofen acts on. So we have already seen the mechanism of action of this propionic acid derivatives or the ibuprofen or the NSAIDs in general. Okay, so options are lipoxygenase, cyclooxygenase, kinase system, serotonin system. And the correct answer over here will be cyclooxygenase pathway, correct? So that's it for today. Thank you.